Hey everyone, I'm Michael Uriarty or Dr. Mike, and welcome to Technique Talk, the MYK system, and more. This is episode 48 in our series, and today we're going to interview Dr. Christine Foss on sports chiropractic. Today we're going to cover information from Dr. Christine's background, all of her degrees. She's a super smart person. Her new book, Dissecting Sports Injuries of the Hip, how she teaches at many state conventions, college homecomings, major colleges, and more. I told you she was smart. Whatever profession you are, she will come and speak at your state convention. DCs, PTs, ATs, OTs, MDs, you name it. And she would be a great addition. Check this out and you'll see. If you want more information about Dr. Christine, I have some links in the description below. I have links to her book in the description below. Hit the subscribe button, like the video, share the video. I have a lot more videos coming. Whether you're a patient looking to get help or a practitioner looking for a good technique to learn, this series is what you need. Let's dive in. All right, Doc. So tell me, what got you interested into healthcare? We're going to start there.
Well, I have to tell you, no one's ever asked me that question before after all the years that I've been doing this. It's actually pretty interesting. I was a gymnast all through high school and college, a ballroom dancer with my brother as my partner, which that's a whole other conversation and probably some deep therapy involved in that, and a ballerina. And what I noticed is that no matter what injury you had, we never really had somebody that we could turn to as athletes that could look at our spine and also look at extremities. So my specialty is as a sports chiropractor. That's most of my training. That's my postdoctoral training. That's really what I focus a lot of my research on. And so really helping these athletes exceed their, maximize their genetic potential or exceed expectations by sidelining injuries or, emerging from an injury that maybe allopathic care hasn't been able to kind of tackle. So that's really what's gotten me intrigued with this. As in undergraduate school, I was an athletic trainer. I also have my master's degree in sports medicine. So I was an athletic trainer for many years. Still am proudly. And I think that training really brought me into the sports arena, being an athlete myself and, just kind of growing. And when I was I was working at University of Notre Dame as an athletic trainer, traveling with this, football and all the teams. And it was wonderful and amazing. But I always felt like there was just something missing. And so I had this epiphany about chiropractic. And within 2 months, I was sitting in chiropractic school. I just knew it was the right thing. And I'm going to tell you, this is an amazing, very rewarding profession. Like I have to say, it's all rainbows and butterflies, I think, in chiropractic, as far as, my world goes, sports chiropractic.
Wow. All right. So you went and got your athletic training degree. This was prior to, because now they have a doctorate in athletic training. So this was just
Yeah.
when you got was it a master's? What
Yep.
was it back then? Master's?
Masters. Yep.
Master's in athletic training. And what school did you go to for that?
Old Dominion in Virginia.
Old Dominion in Virginia, and then you ended up at Notre Dame.
Yeah. So it was pretty amazing to get that opportunity to work there with the athletes. And it was the only word I could ever think of when I describe Notre Dame is awesome. Like it's
Yeah.
just
Oh, of course. Of course. I visited there once, and of course we got to go see the Four Horsemen and
yeah,
that
yeah,
whole
yeah.
thing, and
Mhm, mhm.
which was pretty neat.
Yeah.
Who was the football coach at that time? Do you?
So Lou Holtz was just finishing up way back then, which
Okay.
was amazing to see, to kind of listen to the stories on Lou Holtz and watch him in action was just really crazy. It was really amazing.
So you got a year or two with
Yeah.
Lou.
Yep. two
Oh,
years. Mhm.
really nice.
Yeah.
Wow. Okay. And so from there, so you worked there for a number of years, and then you decided to go to chiropractic school,
Yeah.
and you got your chiropractic degree, and then where'd you go?
So then I opened a private practice in New Jersey, which was just grew. Like we had to keep getting bigger buildings because it was growing more and more. And I
Nice.
just was very, very
Nice.
fortunate and lucky. And actually, then I went back to medical school. I really wanted to learn a little bit more about the human body, and I really wanted to understand how a medical doctor is trained compared to a chiropractor. How do we come from two very different directions, and can we converge on our diagnosis, or do we just cross laser beams, so to speak? So I went to med school and graduated med school, did my boards, and did all my rotations, and then said, I don't like this too much. I just wasn't, I was really interested in going back to my practice because that's really where my heart was.
Wow. Now I got
Yeah.
to tell you, I'm kind of lazy. I think I would have just tried to talk to a medical doctor instead of going going back to school. That's impressive. It
I
really
think
is.
you're kind of smart, not lazy. You're
That's
smart.
right. So did you work a couple years with your medical degree as far as that being the primary or
No, so here's this backstory. I was finishing up my rotations, and I was doing a bariatric surgery. And in the OR, I kept looking at my watch and looking at my watch, and I was like, "Why do you keep looking at your watch?" And I realized that after that surgery was done, I could go back to my office and treat my patients because I was still working as a chiropractor that whole time. And I thought, well, that's really what it is. So I never did residency. I just said, I'm not, my practice was very successful. So I said, I'm going to take this knowledge and punt with it and go back to my practice. Yeah.
gotcha, gotcha.
Mhm.
So at that time in Jersey, how long were you up there?
So forever, I'm just relocated down to Florida 2 years ago.
Oh,
So I
okay.
owned a practice for about 20 years up there, which was just an amazing, a multidisciplinary practice: PT, acupuncture, athletic trainers, chiropractors, pain management.
Oh,
Um,
nice.
yeah, it was really
Nice.
amazing.
And did you get to work with some of the teams? I'm assuming you
Oh yeah,
around
so I
them.
travel a lot with Team USA. I traveled to track, men's gymnastics, women's gymnastics, bobsled, skeleton. So different teams would hire me on to go to championships with them. I've been to World Games. I've been all over the world working with athletes. It's just been. I know I keep saying the same thing, but I feel like looking back, really fortunate to have all these great experiences.
Oh, absolutely. Absolutely. So let me ask you this, because I know that I I kind of fell into. I got very fortunate. I was invited up to teach. The University of Idaho started the doctorate program for athletic trainers, and so I
Nice.
got very early on. I got invited up to teach a class, and they were like, "Hey, you want to come back again? Hey, you want to? How about we just incorporate you?" And I was like, "Oh my
Amazing.
goodness," you know. So I kind of got in, but kind of a fluke in my opinion how I got in. So how did you? Because I looked at some of the stuff online. You've worked with like you had mentioned the bobsled team, but that was like I think the Austrian
Mhm.
bobsled team, but then
Yeah.
there's US gymnastics, there
Yeah.
was US track and field. How did you get mixed up with that?
Mhm. Yeah. So I've worked at the Olympic training centers, so the Chula Vista up in Lake Placid and Colorado multiple times, and just, started good relationships there. And, I love, that's kind of my thing, is working with athletes. So I think, like you, and I don't think it was a fluke that you got that job because you were able to stay there. That means that they really liked you and you had a positive effect, which is really amazing for us as chiropractors, right?
Right.
I just think you just resonate in certain places.
Right, right. Okay. Okay. So do you got to have a couple stories. Do you have any stories from some either, one of the teams, something that happened?
Yeah, I have lots of really fun stories, actually.
Let's hear a couple.
I'll
I want
tell
to
you
hear a
one that
couple.
jumps to my mind right now. This is when I was working in bobsled world championships. I was commissioned to go out to Austria for 2 weeks to work their championships. And so they have me stay in somebody's house, which was a whole interesting thing. But I go out to the mountain and I set up like a polyclinic like we do in the Olympics, right? And that meant any athlete from any delegation could come and get treated. We do this because, and I work with this organization called Fix, which I was their director of education. We do this because so many countries, it's not a level playing field for athletes, right? When we rock up as Team USA, as a team, We've got chiropractors, massage therapists, athletic trainers. We have the sports medicine docs. We have portable ultrasound machines. We have sports psychologists. We show up. Let's talk about Mexican athletes. Maybe I remember that from one particular event. They don't even have tape.
Oh,
So, see, the budget is not the same. So, the organization that I work with is called Fix, and our mission is to provide care for everybody. So, this one particular commission, I went out for 2 weeks to provide a polyclinic for athletes. One morning, early in the morning, a van pulls up of Romanian bobsledders, men, and they dump one guy off, walk him in, and leave him with me. And it's just me and him in the clinic. He speaks zero English. I clearly speak zero Romanian, right? And he has a groin injury. And so the pantomime that happened for me to
right.
get him to take his pants off and look on his face when I wanted him to, because he had snow pants on, pull your pants off. And he's looking at me like, you sure? Like, you sure? It was just a really fun day at the office, that's for sure. We got him patched up, fixed, and back on the mountain, but it was an interesting correspondence, that's for sure.
That's funny. That's funny. So you're with the oh man, I'm gonna mess this up. But it's
Okay.
like the Federation of Sports Chiropractic or something?
Federation International of Chiropractic Sports.
Chiropractic sports. And
Mhm.
so how long have you been with
Oh boy, I've been working with them for it's got to be almost 10 years now.
okay, okay. And how'd you get involved in that?
It's a volunteer organization,
Oh, okay.
and for global equality, as far as providing chiropractic to athletes, I really love that mission. I love I lecture internationally, so um, I love to travel, and so for me, it just was a perfect fit. And they're honestly a great group of people, like positive energy, there for the right reason. Everybody just giving their time.
So with that organization, you would go to another country for sporting events?
Yep. So yes, we have contracts to provide chiropractic care. I just got a call the other day. Do you want to go to Abu Dhabi for over Thanksgiving to work with World Championship Kickboxing? So they'll ask, if you want to travel to certain places, but also this organization, as I said, I'm one of their master instructors. So I travel to different countries to teach other chiropractors how to work with athletes. How do we do what I do?
So do you have to be, because you just said like with kickboxing and different things. So you've got bobsled, you've got gymnastics, you've got track and field. They have to have different injuries in.
100%. Yes. Yes.
So is there specialized training for that, or you're just going in and going, okay, I've seen this before, or
Yeah. So, kind of globally understanding injuries in sport. And then when you go through the training, you do review what's prevalent in certain sports. However, some things you've got to do your own back work. You've got to research ahead of time. What should I see? What should I expect? Talking to people that have covered that event. One time I covered, of all things, sumo wrestling. Who the heck prepares for that? How do I prepare for that? Is my table going to hold a sumo wrestler? Is my first question, So, just, just rolling with it to a degree, but also trying to kind of fill in the backstory with other people that have maybe been there already.
right, right. So, okay, now we're going to back up because we skipped a step, I think,
Mhm.
because to get to all the sports chiropractic stuff, we have the certified chiropractic sports.
DCSP.
Yeah. And so what does that entail? I haven't gone through it. So what does that entail?
So I'm actually the director of that program for Northeast
Oh,
College right
nice.
now. So I wrote that program for them, and that's a really nice 100-hour class. And there's several of them through the country. That's not the only one. 100 hours provides the chiropractor good base, a nice foundation for working with athletes. There's a test that you have to take through ACBSP, the American Chiropractic Board of Sports Physicians. You sit for that exam. If you pass that exam, then you are officially a CCSP.
Gotcha. And then there's continuing ed on top of that to
Then you
to
can
keep
become a
that straight.
diplomate after that. So diplomate is 300 hours.
Oh,
And
gotcha.
so then you become a diplomate. You can sit for that exam as well.
Gotcha. Okay. And so how long have you been teaching that?
Ooh, that's a tough question for me. I would say I wrote that program, let's say it was 5 years ago.
Nice.
Yeah,
Do you teach continuing ed classes, or is it just at Northwestern?
at Northeastern.
Northeastern.
Yeah, I'm on the road most weekends a month teaching somewhere, homecomings or conventions or yeah, I'm pretty much teaching all the time. I teach a little more recently because I published a book last November. And so I have, certainly more requests to teach that particular topic, which is the hip. And yeah, I'm actually heading out to Cleveland Chiropractic College's homecoming this weekend to lecture.
Oh, nice.
Mhm.
Nice. Cleveland is so I was in Kansas City for 30
Oh,
years.
oh, there you
That's
go.
that's where I was. So I used to go take all my classes at Cleveland all the
Okay.
time.
I
Yeah.
haven't been there yet. It's my first time there. I'm really excited about it.
Oh, you'll like Kansas City. It's a good little area. Um, so do you have other classes th that you teach for like continuing ed that
Yeah.
people could sign up for a class and go, "Oh, I'm going to get 8 hours with you or 10 hours
Yeah.
with you."
Yeah. Oh, yeah. Pretty much, like I said, check out your state association because more than likely I'm there because I feel like I'm everywhere these days. But
Okay.
I am also, my specialty is kinetic chain right now. And the hip, of course, is kind of my immersion, but kinetic chain is really my fixation. Look, tracing injury to the why. Why did it occur? Not just myopically that it's there.
Nice. Okay, so if somebody, so you would do that with the hip. So
Mm,
somebody has a hip injury. This is you just wrote a book on this. So,
yeah.
and the name of your book, I have it written down, is Dissecting Sports Injuries of the Hip.
Yeah.
And you can get that, you can
On
buy that
Amazon.
on Amazon. So I'll put
Yeah.
that in the show notes below
Yeah.
when we're done here.
Thanks.
But so if we went through a little bit, you don't have to, but the you're going to go through like the anatomy of the hip and all that kind of stuff, and then different injuries of the hip, and then how to fix.
Are you saying the book or are you
Yeah,
saying,
the book.
okay, so the book is, I'm going to tell you the genesis. I wrote the book on the hip because as I travel around the globe, I've noticed the one thing we're missing as chiropractors, and that's a command of the hip.
Okay.
And the hip and the low back are so intimately related that if your hip, particularly, is missing internal rotation, your incidence of low back pain is significantly higher. And so, and your ability to recover from low back pain if you have a hip problem is significantly lower. And then we also noticed that, which was really interesting when I was doing research for this book, the orthos that are doing total hip replacements that were kind of not leveling the spine, they're probably a longer leg on one side, they were noticing they were having failed surgeries. So they went and they really evaluated this leg length discrepancy, how much it affects back pain when the hip and the back are related. So in the book, I keyed off on a lot of the research from the orthos that they did learn from failed hip surgeries. But the book is really dissecting sports injuries because we used cadavers. Also, Northeast was wonderful enough to let us use cadavers to show the actual gross dissection. And then we have graphics of each, how to assess, how to diagnose, how to treat, what the imaging might look like, what you want to do to progress a patient for each injury you could potentially think of in the hip. It's 400 pages, so there's a lot in there.
There's a lot. Yes.
It's a lot of stuff.
So what's the kinetic chain? Is that what you
Yeah.
said? Yeah. So
So
give me a definition and an example.
the kinetic chain is watching, imagine watching a patient move. And let's say I just had one boy the other day, and I wish I could bring up his picture. Young boy, 2 years of back pain, has been everywhere PT, ortho, ablation in his facet injections, you name it, right? 2 years, 16-year-old boy. I check movement. Everybody goes on a treadmill, everybody gets video analysis, then I watch squat analysis. I want to see your body against gravity moving. Because from the minute your foot hits the ground, what happens? Do you hold that plantar vault? Does your tibia internally or externally rotate too much? What does your femur do? How does it throw up your pelvic leveling? Does your head come forward? That chain of events that happens all leads to stability in the spine or the pelvis or the neck, right? And if you don't have that, let's say if I don't have foot stability, I can't have a good back. You can't have a good back. So looking at all the whys of somebody has a problem, as opposed to just, I can diagnose that problem.
I gotcha. Yeah.
Yeah.
Yeah. Okay, so there's different philosophies. I'm going to
Hmm.
put you on the spot on this one.
Yeah.
There's different
Okay.
philosophies because in chiropractic they say, correct the neck, you'll correct everything below it, correct the low back, you'll correct everything, correct the feet, you'll correct everything above it. I've always bought into all of them because I thought it depends on the person. But
Mhm.
what's your thought?
Yeah. Yeah. I think that there's argument in many directions there. If we really look at the three pinnacle parts, think of, like, now that I'm down in Florida, the body like a palm tree, right? If we look at the foot and we look at the hip and we look at the cervical thoracic junction, if those three things are in line, really our spine is going to be level too. And so, I think what we've got to do is, as chiropractors, we're so good at looking at everything that we own the kinetic chain really secretly. And we have to really expand our desire to get the patient off the table and look at them against gravity. And I think maybe it is just their neck that's throwing out everything else off, or maybe it's three things, so you could apply
Right.
many directions there.
So would you, when you say you're gonna look at them, would you be looking at them from the side or from the front, or is that
Yep. So I do images from the front, from the side, and from the back, statically and dynamically.
so okay, okay, and so dynamically is that just having them walk,
It
walking
depends
to
on the
you in a way?
athlete. So
Oh,
every athlete has to use their body differently. So a runner, for me, they're running. A power lifter, they're squatting. So I have football players. If they're a receiver, I want to see them how they receive. So I want to watch them run back and catch a ball. My golfers, I have a golf simulator in the office. We get them swinging into the simulator. I want to see how they move.
gotcha. So are you going out sometimes to do an eval, like for the football player? Are you going like you're going outside and saying let me and filming them?
Yeah, yeah.
Gotcha.
Whatever needs to be done. I need to see their body in action.
Gotcha. Okay, so a swimmer, see him in the pool.
Yeah. Yeah. Or a lot of times they have video. So I ask them to bring me video. So if it's something that, if I have people come from different states sometimes to see me, or from a distance, I need to see a video.
And yeah, and usually they have something, right? Usually
Oh, yeah. Oh, yeah.
they have plenty. Um, wow, this is all right. This is pretty cool. So new people coming out. We were talking earlier. We both have our daughters that yours has graduated, mine is getting ready to graduate from chiropractic school.
Same.
So what is there advice? Is there anything you would say as far as someone who's saying, man, I think I'm interested in getting into this sports
Mhm.
stuff?
Yeah. I would say, and I get this question all the time because I do work with a number of students, is you will use, like, say you take your CCSP exam or you go through that CCSP program, you're going to use that all day long in your private practice. It's not knowledge wasted. I think about, going to practice, how many pickleballers down here. Holy smoke, the pickleballers, right? That's a whole other stuff. But shoulder injuries, tendonitis, ankle sprains, knee injuries, we can use all that knowledge in our practice. So if you're interested in sports a little bit, I really highly recommend, going in and either taking a CCSP or an ICSC program. That's the fixed program. That's the 100 hours. Both of those provide a solid base to something you can use in private practice and on the field as well.
And that information wouldn't be just sports, right? It would be just people coming in saying my hip hurts, my shoulder
Exactly.
hurts, and
It's
then you
it's
could
huge.
evaluate it. Yeah, that way. Nice. Okay. Is there anything that you is there anything that you wanted to talk about as far as something you have coming up or
Well, I'm actually, Northeast is very nice to sponsor me full day kinetic chain classes. And this is something that I just started kind of manifesting because so many people at the end of my lectures ask, what book can I read, or where can I find this information? And this is just really a culmination of years of experience that I am actually just starting to put down in a new book, the kinetic chain book that I'm making, but it'll
oh,
be more of a workbook for my classes that'll be live. So they'll be down here in South Florida. Wouldn't hurt to come down and get some sunshine, play some golf, and then we're going to do an 8 to 12 hour just kinetic chain immersion.
And when's that going to start?
The first one will start in the spring of next year.
Spring of next year.
Mhm.
Okay. And now, do you do any? So that'll be in person. Those are in
Yeah,
person.
live. Mhm.
Do you do any online courses?
I do webinars upon request. So a lot of times associations will ask me to jump into a webinar, or colleges will ask me if I could, jump on and work with some students, and happy to do that. Sports clubs in the colleges and stuff.
Oh, gotcha. Yeah, 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 yeah. I do webinars, I do in person, and for me personally, there's nothing like the in person.
Yes.
There's just something about the energy of the room and you know, yeah.
Yeah, and I always like to do workshops. I don't like the docs sitting in the seats. I
Oh,
want them up and I
exactly.
want their hands on their buddy. And so pretty much all my lectures are workshops in some way.
Yeah. I got invited to Texas Chiropractic College for their homecoming one year. And
Mhm.
so I was going to do a lecture on headaches. And so
Mm.
I got up, there was 150 docs in there, and they're all sitting like this, and I had my slides all ready to go. And I got up and I'm like, you know what? Let's do this. Let's all stand up. Let's all go over here. We're going to do some hands-on just to
Yes.
get them involved.
Yes,
And
exactly.
and it changed
Exactly.
the whole,
Yeah.
chemistry of the class there.
I think
Yeah.
everybody likes that better, right? When
Yeah,
they're
for
moving as
sure.
opposed to sitting.
For sure. Getting hands-on is
Mhm.
always better.
Mhm.
So you're in practice, but also teaching.
Mhm.
So you're busy right now.
Yeah, I like to be busy. I like
Yeah.
busy.
Yeah, well, we got a sense of that when you said you went back to medical school. That's goodness. So, um, all right, very good. That was good. So, if people have questions about, they can go to Northeastern, right? They can go to the school website and
Yep.
look at sports classes and things like that. Do people contact you for info or for things, or
Oh,
do
pretty
you have
much,
them go?
yeah, all the time. They can also go to Fix's website. It's called fics.sport. They have classes as well, which is
Okay.
really nice. That's another avenue. But certainly, looking me up, I get students all the time asking questions, or docs asking questions. Happy to help. I know this kind of sounds whatever. I don't want to use the word nerdy, but nerds rule the world, by the way. But but I'm really here to, I feel like we all need to help each other elevate this profession. It's the most amazing profession. And I really want to see it continue to lift up and grow. And we do that by helping each other. Let's all stand on the shoulders of those before us, and let's just keep, making us great. And I think now, with everything going on with allopathic medicine and, different things, I think we really have a wonderful opportunity to keep making this thing bigger than it is today.
I love that. I love that. That's awesome. That's awesome. Well, Doc, that was really good. I would I would like to in the future bring you back, and especially when you get the new information published and stuff. I'd like
Okay,
to,
sure.
yeah, bring you
Sure.
back and do this again. So I learned a lot already just in that short little talk that we had, but that was good. That was
Yeah,
good.
thanks.
If you made it this far, smile.